So now, we want to train our patient to assume a correct posture, specifically the upper quadrant of the body, the neck and the upper thoracic part, okay, the upper back. Okay, so to teach the patient on how to correct his or her posture, you may also use a mirror here, a postural mirror here on the front, and also a postural mirror on the lateral side of the patient to provide visual cues to the patient. Aside from you doing the corrective positioning of your body. So the first corrective exercise is what they call scapular retraction. So you just you ask the patient to bring his shoulder posterior. It's like doing a chest out and asking the patient to retract his scapula. So, ang instruction niya usually, ma'am, if imagine that you want to hold this hand in between your shoulder blades. Do it. Then you can hold it for 6 seconds. Okay? Hold. Or for starter, yung sa mga pangit talaga yung posture, you can ask the patient to do it by repetition muna. So, do repetitive na retraction and protraction. Okay? So that the patient can feel the kinesthetic awareness of the positioning of the scapula and the shoulder in a correct posture. While looking at the mirror on the lateral side, the patient can perform the scapular retraction. So now, why did I teach first or demonstrated the scapular retraction before the chin tucking? Okay? Please be reminded that the base of your neck and your head is always the shoulder. If the shoulder is not aligned, not correctly aligned, then it will be very difficult for you to do chin tucking if the shoulder is in protected position, since this is the base. So you start with the shoulder, correct the position of the shoulder, then when you teach chin tucking, you can now do chin tucking after the correction of the shoulder position. So chin tucking is just bringing of your chin towards your neck. Okay, like this. So make sure to do chin tucking like this. Make sure diretso yung head. Okay, normal yung cervical lordosis, and bring your chin to inward. Okay, so that's how you do it. You can demonstrate it to your patient, and of course you can do a visual feedback using a mirror, and also you can do a tactile feedback by passively positioning the patient's head. Please be reminded again that there's a difference between chin tucking from cervical flexion. Okay, so it's just a movement of the capital or the head. So nag-aano lang siya, para ka lang tumatango. So it's just a capital flexion, not cervical flexion. Okay? So you do that. So by repetition, so yung patient from forward head posture, she do the chin tucking exercises. So you can do this. This is ready. You instruct like this. So ma'am, if this is my hand, don't let me touch your chin or yung upper lip. Okay? So the patient will do a chin tucking exercise while you stabilizing at the backside. Make sure that the shoulder is in retracted position when you train the patient to do chin tucking exercises. Now, for starter, this is quite advanced. If you want to initiate chin tucking, you may do it first in supine position with proper feedback so that you can train the patient on how to activate the deep core muscles of the neck prior to do it in sitting position.